So the FTC issued their second report on PBMs. The first one was on the role of rebates and the relationship between the PBMs and the insurers. And this one was really interesting. It focused on generic drugs and looking at the price hikes that the PBMs institute. They specifically looked at 51 drugs. Many of them were HIV, surprisingly. And it showed that sometimes it was over 1,000% of the list price of a generic drug. And the one that really caught my attention was generic PrEP, generic Truvada, which was just approved a couple of years ago as a generic. And they looked at 3 years. So say the list price is, $100. That means they were charging $1,000. Unfortunately, we're finding that despite the ACA requirements that preventive drugs such as PrEP should be free, no cost sharing, and also the visits too. We're still finding that both for drugs and for the ancillary services, around 1/3 of all people are being charged, and they shouldn't be. And it's a real deterrent to people. We want people to get on PrEP. Certain communities, it's really, really low, and we need to increase those numbers. But when you're being charged, when it's supposed to be free, it really deters people from accessing the drug. So, the federal government has looked into this. They sent a guidance out to the insurers saying to remind them that it's their obligation to make sure that the providers know the billing codes. That's one of the problems, that the providers don't know the billing codes and they just deny. The SOCIO issued guidance that said that you can't do that. You have to look into these and make sure the providers have the correct billing information. So hopefully there'll be more oversight and enforcement of these coverage of preventive services in the future.